Welcome back, Lake Tahoe. I am joined today by Dr. Miriam Locke with Barton Urologist, and you're here with us to talk with us today about men's health.
Yes.
June is Men's Health Month, and what is important about urology? Really, what is urology? Can you give us the rundown as the expert in the room?
Sure. So urology is essentially the treatment of the urinary tract for both men and women, and then also male reproductive system. So urinary tract, that's the kidneys, the ureter, the bladder, the urethra, the prostate. Essentially, anywhere urine travels, I am the plumber of that tract. So that means if there's a blockage from a kidney stone, if a prostate's making it so you can't empty yourself well, I'm the person who treats that. If there are leaky valves, if you're leaking from your urine, I'm the person that patients come to see. And then also for men's sexual health, I manage erectile dysfunction for patients. We manage family planning for men, whether it's infertility or the option to have a vasectomy, and then cancers of any of those organs, so the kidney, the bladder, the prostate, and testicles.
Absolutely. Well, what are some of the most common things that men face, especially as they age, in terms of urology?
Sure. So I think the number one thing we all think about is prostate, and whether that's having difficulty urinating, getting up at night too many times, just standing at the toilet and it taking too long. But also erectile dysfunction is something that a lot of men face. And so, I think the problem is for men is they just say, well, it's normal. I'm old and I should pee a lot, or it's okay. Everybody gets up 3 times a night. And that's not true. I mean, we say if you have an elevated blood pressure, you should be treated. Same thing for urologic problems, so.
Absolutely, that makes sense. We all deserve to age gracefully and
Yes.
comfortably. So what are things that men can do as they're getting into their older ages to be preventative and help be on top of this urological health?
Sure. So, number one is leading a healthy lifestyle, which luckily in Tahoe, everybody does. All my patients are incredible. They ski 80 times a year. But making sure you're hydrating well to prevent those kidney stones. It just helps make sure that all of your organs are really working well. Exercising is really important. Studies show that if you do a cardio workout 3 times a week, that can help treat or prevent ED. Going to your regular checkups. So if you have those bothersome symptoms and you don't bring it up to anybody, it's never going to be managed or fixed. Getting screened for prostate cancer. It's the number 1 cause of cancer in men besides skin cancers. Number 2 cause of cancer-related death in men. So just making sure you get those blood tests every year is really important.
Absolutely. Well, Miriam, thank you so much for coming in and sharing this valuable information. People can go to bartonhealth.org for more information.
Yep.
Fantastic. Well, I appreciate you, and we appreciate you as well. Be sure to stick around for more Outside Lake Tahoe.